Is Vampire Facelift a good way for anti-aging? Is it worth it, or is it just marketing?
Thank you for your question. You're asking a very simple question. Is the Vampire Facelift a good approach to anti-aging, or is it just good marketing? Well, I can certainly address this question with authority. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I am a member of the Vampire Facelift network of doctors, and I've been so for many years. In fact, I've also been a resource to the media when questions about the Vampire Facelift has arisen. So I can certainly understand your skepticism because of the name. So I can also tell you that if you ask doctors who aren't part of it, if it's a gimmick, they'll most likely say it is. And those doctors who don't understand PRP and the interaction of PRP with hyaluronic acid will also say that. But I think that the evidence speaks for itself, and I'll give you some guidance and detail as to what it can do, what it cannot do. And as far as the question of whether or not it's good marketing, I would say it's not just good marketing, it's amazing marketing. I tip my hat to Dr. Charles Runnels, who created this brand, and it has sustained for many years, and remarkably the searches and interest for it exceeds the searches for Botox. What I think has really been the greatest value of this branding project is that more people have become aware of the value of platelet-rich plasma. As a cosmetic reconstructive surgeon, as well as someone who does a lot of cosmetic dermatologic procedures, I cannot stress enough the value that I have been able to provide for patients using platelet-rich plasma. So let's break it down. Vampire Facelift is a combination approach to help someone look younger using the benefit of platelet-rich plasma in the skin combined with a single syringe of a hyaluronic acid filler such as Restylane or Juvederm. That's it. The benefit of the Vampire Facelift, which is the combination of platelet-rich fibrin matrix, which Dr. Runnels clearly makes this distinction between that and PRP. But for just the sake of brevity, I'm going to use PRP since fewer people are familiar with PRFM, or platelet-rich fibrin matrix. Basically, this is a form of PRP which has been activated so that there's even more benefit during the treatment. From a scientific perspective, there have been so many hundreds of articles about PRP in the medical literature, and specifically from the cosmetic surgical perspective, there have been peer-reviewed published articles showing the increase in blood supply, increase in fat, which is interesting, as well as collagen in skin that was biopsied after the use of platelet-rich plasma. So the scientific evidence is there. Now, the use of hyaluronic acid in combination has two benefits. One is platelet-rich plasma is still not something that can add volume that is immediate or defined. It's more global. PRP people who we treat with this will say their skin has this glow and this nice skin quality. When you're using a hyaluronic acid filler, you can augment or enhance the area outside of the brow, the cheeks, the outer corner of the lips, and give someone a more youthful look. I think that it has applications for a lot of scenarios, but you have to decide whether it might be right for you by having a proper consultation. When we educate patients about this, I also explain not only in the Vampire Facelift concept, but actually there is a synergy that has been established in the medical literature of hyaluronic acid with platelet-rich plasma. In wound healing processes that have nothing to do with cosmetic surgery or cosmetic medicine, it has been shown that there is a benefit of combining the two. I have made this observation when I have done this for patients with scars, for depressed scars and acne scars. So the fact that the name Vampire Facelift has become so viral and so interesting is certainly effective marketing. But if it's right for you depends on your situation. In the field of cosmetic surgery, cosmetic medicine, it's all about customization. It's all about finding the right doctor who understands your situation, who will be ethical and be able to provide you a comprehensive solution. Unfortunately, with this explosion of interest in the cosmetic procedures and a lot of non-surgical options, there are a lot of different providers offering a lot of different solutions, but most have, or many I should say, have limitations. If they have a new laser, they want to use that new laser for everything. If they're marketing product A, B, or C, they want to do that. In our practice as a board-certified cosmetic surgeon, I offer everything from skincare products to advanced surgery, so we're able to really help our patients in a customized way. And if someone comes in for this procedure and isn't a good candidate, you can be sure that I tell them they're not a good candidate. So hopefully this explanation will give you some guidance before you meet with a specialist to learn about your options that are right for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.